Thank you, Professor Tsutsumi. Now I will go to the other session about HIFU. We have the wonderful speaker, Zhang Cai. 张彩教授，你要用英文演讲吗？还是中文
？Yes, I will talk in English.
Okay, good. We have the wonderful speaker, Dr. Zhang Cai. Actually, the Dr. Zhang Cai is the senior HIFU doctor and also the very wonderful, well-experienced tutor, and have a lot of the experience. Also is a membership of the International Society of the Minimal Invasive and Virtual Surgery, and also the reviewer of the International Journal of the Hyperthermia. Dr. Zhang ever provide clinical training of the HIFU treatment at home and abroad, and ever been South Africa and Jordan and South Korea, and to help to establish the HIFU center. So he also ever training more than 15 domestic doctors and more than 20 international medical staff, and have complete about 4,000 HIFU treatment cases. So it's well experienced doctor and the tutor. So let's welcome Dr. Zhang.
Okay.
Now you will give us the topic is the HIFU, followed by DNC to treat the cesarean scar pregnancy, the clinical protocol and the outcome. Please, Dr. Zhang.
Okay. So can you see my screen?
Yes, now.
Okay. So thank you, Dr. Chang. I'm Zhang Cai from National Engineering Research Center of Ultrasound Medicine. Today, I will talk about HIFU followed by dilation and curettage to treat cesarean scar pregnancy and the clinical protocol and outcomes. My talk will include 5 parts. So first is the background about the cesarean scar pregnancy. It is defined as the gestational sac implants at the scar site of the previous cesarean section on the lower anterior uterine wall. We can see that here is a wedge shape, and this area suggesting possible impaired healing. And it is reported that the prevalence of cesarean defect in women with cesarean section is up to 84%. And this kind of disease is first described in 1978. And the incidence is rare, but is between 1,1800 to 1,2200, and it accounts for 6.1% of ectopic pregnancy with a history of at least 1 cesarean delivery. And in recent years, the risk and the incidence of the CSP has been increased. We can see from a report from 2010 from the World Health Organization global survey, it showed that in Asia, the cesarean section rate is about 27%. And in China is extremely high as 46%. And here is another report by our Chinese people in 2014. That is 4 years later. This rate is increased to 55% for the cesarean section. So because the cesarean section rate is increased, so the risk of the cesarean scar pregnancy is also risk. And in the past 2 decades, I searched the literature. We found that the publication about CSP in the past 2 decades is more than 1,100 papers. And we can see it here is uptrend. And also we can see that the highest number of publication is in China, followed by the North American and the England. And the types of CSP it has been introduced for the first lecturer, that is Professor Adlan. And I find here is an international classification. It is divided by two types. The first type is the endogenous type, that we can see the gestational sac is totally inside the uterine cavity. And the type 2 is the exogenic type. So we can see that the gestational sac is growing outside and to the bladder and to the abdominal cavity. So this is an international classification. And also, as Professor Adlan said, that in China, our Chinese domestic classification also has a little bit different from the international one. So here are three types. The type 1 and the type 2 are the endogenic type, but the difference is that, so for the type 1, that the most gestational sac located in the uterine cavity and only partially implanted in the scar. And the thickness of the uterine myometrium between the bladder and the gestational sac is more than 3 millimeters. But the type 2 is that the most gestational sac implanted in the scar and the thickness of the uterine myometrium between the bladder and gestational sac is no more than 3 millimeters. So this is the difference between these two types. And also we have the type 3. So the type 3 is that the gestational sac completely implanted in the myometrium of the uterine scar area, and it protrude outward to the bladder or to the abdominal cavity. And also in this consensus, they introduced a subtype of the type 3, that is the mass type. So in this type, it is usually after the CSP abortion. So if we do the ultrasound check for the patient, we can see in the scar area, here are the mixed ultrasound echo, because the mass has the cystic and the solid tissue inside, which including the residue of the scar pregnancy and the hematoma. So this is a Chinese classification. And what is the risk of CSP? So here I talk about 3 risks. The first, the bleeding during the first trimester of pregnancy. And the second, the increased risk of massive bleeding from the side of the implantation. And the third is that the uterine rupture because of the deep implantation and the growth of the gestational sac. And the last 2 are life-threatening. And for the treatment of the CSP, we should know that there is no consensus for the management of the CSP. The aim of the treatment is to first try our best to preserve the patient fertility. And the second is to prevent the life-threatening complications, including the massive hemorrhage and the uterine rupture. So these methods are all have been used to treat the cesarean scar pregnancy. The first one is medical therapy, in which the MTX is the most used, including the local usage or the general usage. And also we use the, And we also use the uterine artery embolization and dilation and cartilage, laparoscopic excision, hysteroscopic resection, and hysterectomy. In the past, more than 10 years ago, I think the high intensity focused ultrasound, which is HIFU, has been introduced to treat the CSP. And so let's talk about the HIFU treatment of the cesarean scar pregnancy. Before we talk about the treatment of CSP, let's review the principle of HIFU. So the HIFU is that the high intensity focused ultrasound waves are focused at the focal spot by the transducer and to increase the focal spot, the temperature is more than 65 centigrade and the coagulative necrosis is induced. And also we need to know that the effect of HIFU is not only the heating effect, it has 3 effects, including the heating effect, cavitation effect, and mechanical effect. So how HIFU to treat the cesarean scar pregnancy? We recommend the combined therapy, which is the HIFU plus the ultrasound guided DNC or HIFU plus the hysteroscopic DNC. So what is the role of HIFU in CSP? So the first is to reduce the risk of the massive hemorrhage during the following DNC and to minimize the damage to the uterus because it is non-invasive and to keep the integrity of the uterus and maybe can give the chance of quick recovery of the implantation area and to shorten the interval between the scar pregnancy and the following pregnancy. So for the HIFU treatment of cesarean scar pregnancy, we have the inclusion criteria and the exclusion criteria. For the inclusion criteria, the patient should be more than 18 years old, and we recommend the type 1 CSP, which is endogenic CSP, and the gestational age is no more than 10 weeks, and the size of the gestational sac is no more than 5 centimeters. And for the exclusion criteria, and there is no active vaginal massive bleeding, and patient should not have the risk of a highly risk of the uterine perforation or the rupture. And if the patient have the acute inflammation of the reproductive system, the patient is not suitable for HIFU. We need to control her infection first. And the previous high dose abdominal radiotherapy is also the exclusion criteria. And for the last one is the technical exclusion. Is that if we have the intestinal adhesion in acoustic pathway, that means when the ultrasound go past the bowel, there is a high risk of the bowel injury. So we should not do HIFU treatment for this kind of patient. And so what is the HIFU protocol of the CSP? So first, if the patient have been diagnosed of the cesarean scar pregnancy by the ultrasound or the contrast MRI, and also the patient is meet the inclusion criteria I mentioned before, and the patient can be prepared to do the HIFU treatment. So pre-treatment, we need to do some preparation, including the diet preparation and bowel preparation. Bowel preparation, we can do the catharsis and also the enema. Enema is not the standard or the compulsive. And we also need to do the skin preparation, including the degas and degrease, and also the catheterization before the HIFU treatment. And then we do the HIFU treatment for this kind of patient. After the treatment, after HIFU, about 2 to 3 days, and we can do the ultrasound guided or the hysteroscopic DNC for the patient. And then we need to monitor the patient or need to follow up the patient strictly, especially for the serum beta HCG and the decrease. And we need to maybe to do the serum check every week. And we also need to monitor the patient for the vaginal bleeding duration and follow her up for the time of her menstruation return to normal. So this is the HIFU protocol of the cesarean scar pregnancy. And let's talk about the HIFU treatment. So what is the HIFU treatment for the CSP? The purpose for HIFU is that we can ablate the nutrition vessels of the gestational sac in the scar area. And then we can lose the tightness between the gestational sac and the implantation myometrium. So our focus should be, so this green or the yellow dot represent the focus. So this focus should put in the implantation area, and then we can get the significant hyperechoic scale changes. We can, I can show it in the next slide. So in this slide, I want to show you how to evaluate the HIFU effectiveness. So during the HIFU treatment, we have the real-time ultrasound. So the real-time ultrasound can show us that the significant hyperechoic scale change. We can see that this is the before HIFU and after HIFU, the implantation area has totally changed, the scale totally changed. This is the intra-treatment evaluation. And immediately after the HIFU treatment, we can do the contrast enhanced ultrasound after HIFU. And we can see that the implantation area, which we ablated, we have the non-perfused area or the low perfused area. So this is the two ways to evaluate the HIFU effectiveness. And for our HIFU doctors, we also want to optimize the HIFU treatment. So what kind of the sonication strategy is better for the treatment of CSP? Here is one study conducted by a team. So they retrospective analyzed their treated patient, and they use two kinds of different sonication strategies, and they divide the patient into two groups. The first group is the C-shape sonication, and the other is the I-shape. I will show you what is C-shape and what is I-shape. So we can see from this figure that the shape, we can see that the green dot is put around the sac and in the implantation area like a curve. And the I shape is in the implantation area and along the serrata like a line. So this is two different sonication strategies. And they first compare the baseline characteristics of the patient. We can see that in these two groups, there's no difference between these two groups for the baseline characteristics. But when we compare the HIFU treatment result, we can see that in the I shape, the sonication time is significantly decreased, and also the total energy for the ablation is decreased. So this is the HIFU treatment parameter. And also we analyzed the adverse events. We can see that in the I shape, this group, the buttock pain or the lower abdominal pain is also significantly decreased in this group. And when we compare the ultrasound guided DNC, which is followed by the HIFU treatment, we can see that the operation time or the blood loss or any other adverse events during this procedure, there's no difference between these two groups. So the authors, when they compared these two kinds of strategy, they concluded that the I shape can reduce the sonication time, the energy input, and the rate of buttock pain and lower abdominal pain during the HIFU treatment with no increase of the risk during the DNC. So they conclude that the I shape strategy may be more efficient and safer than the C shape. So this is the HIFU treatment. We're trying to do some optimization for the CSP. And next, I will talk about the comparison of HIFU and UAE, because we know that the uterine artery embolization is another minimal invasive treatment for the cesarean scar pregnancy. So what is the efficacy and the safety between these two technologies? So I find there is a meta-analysis in 2019. In this paper, the authors, researchers, they analyzed 8 papers And from their analysis, we can see that when they compare the beta HCG normalization, we can see that the uterine, the UAE has the shorter time to get the beta HCG to return to the normal. And but for the comparison of the blood loss during the DNC, we found that the HIFE group has the less blood loss during the DNC. And when compare the adverse events, also the HIFE group has the lower rate of the adverse events. And for the comparison of the duration of the hospital stay, also the HIFE group has the shorter hospital stay than the UAE group. And also they analyzed the comparison of the hospitalization expense. This is the HIFE group has the lower expense than the UAE group. And at last, they compared the successful rate and there is no difference. So from this meta-analysis, here is the summary of their results of all these parts I mentioned before. And the researchers concluded that both HIFE and UAE combined with DNC were safe and effective for the cesarean scar pregnancy. And the patients in the HIFE group maybe have better outcomes than those in the UAE group. And HIFE may be a priority option for the early management of CSP. And then we are also concerned about the follow-up and the fertility outcomes after the HIFE treatment of CSP. So I will show you some results. So for the follow-up, I have mentioned before, we especially need to follow up some special index. When I do the literature review from all these literatures, I find that the average time for the serum beta HCG return back to normal is between 28 to 54 days. And the average time duration of the vaginal bleeding after DNC is around 5 to 7 days. And the average time for menstruation return to normal is about 27 to 39 days. And at last, the average time for gestational sac disappear is about 4 to 8 weeks. So this is from the literature review. And then I will show some typical cases that my cases. So the first case is the endogenic type CSP. The 31 years old lady had para 1 with a cesarean section. Her pre-HIFE treatment beta HCG level is nearly 30,000 units. And here is her ultrasound and the MRI imaging before HIFE treatment. And here is the real-time ultrasound during our treatment. So pre-HIFE treatment, we can see the gestational sac very clearly. And here is the implantation area. And during the HIFE treatment, we can see the scale change is induced. And after the treatment, the whole area has this scale change. And immediately after the treatment, when we do the contrast ultrasound, we can see that here has a non-perfused area in this implantation myometry. And we do this patient for 200 sonication time and within half an hour. So 4 days later, we do the DNC for her and we monitored her or followed up her for the beta HCG for several weeks. And we can see here, the beta HCG level is decreased sharply. And when the time go to 52 days after DNC is almost the normal. And this lady, I need to mention that 8 months later, she had another pregnancy, which is the intrauterine pregnancy. So the case 2 is another endogenic type CSP, and she has para 3, and all these 3 babies are the cesarean section. And this patient, she has the gestational sac implanted, and the myometrin thickness is no more than 3 millimeters. And we can see pre-HIF treatment. Here is the gestational sac. And after the treatment, we can see the scale change. And we also do the DNC 4 days after the HIF treatment. And 5 days after the DNC, the beta HCG decreased dramatically. And then we discharged her from the hospital. When we followed her up in the outpatient, we can see that 22 days after the HIF and DNC treatment, the lady's uterine, the uterus becomes too normal, and here is nothing in the implantation area. So the third case is a mass type CSP, and this young lady has 1 periton and with cesarean section, and she had amenorrhea for 81 days. And she had done the abortion in the clinic, and before her go to, which is 1 month before her go to our hospital. And after the abortion, she complained about the persistent mild vaginal bleeding. And the beta HCG is not so high, but when we do the ultrasound and the contrast MRI for her, we can see that here is a mass in the scar area. And we can see from the T2 series, the signal is heterogeneous. So because this patient wants to keep her uterus and to keep the fertility, and we choose HIF for her. And we do the HIF, and after the HIF, because the HCG is not so high, we decided not to do the DNC for her and only do the strictly follow-up. And we follow up her by the ultrasound for 6 months. And we can see that after 6 months, her uterus come back to normal. So this is our 3 typical cases. And we also concerned about the fertility outcome. This is one of my paper published in the International Journal of Hyperthermia. And our team retrospectively reviewed our treatment, the HIF treatment and the DNC for the cesarean scar pregnancy. And we found that in the 154 patients, there are 28 patients has the reproductive requirement. And when we followed up them for more than 5 years, and we found here are 23 pregnancy, and in this 23 pregnancy, here are 18 intrauterine pregnancy, and here are 3 tubal pregnancy and 2 recurrent cesarean scar pregnancy, and all of them have do the laparoscopic excision of the lesion in the first trimester. And we also followed up this intrauterine pregnancy, and we found that here has 12 patients had the full-term birth. And for this 12 patients, we can see that the average interval between the conception and the HIF treatment is 18 months. And all the patients had the full-term gestational age. And all the baby born with the normal weight, and all of them are healthy. And here is another study conducted by another team with a larger group of the CSP patient. They reviewed the patient, the CSP patient treated by HIF or the uterine artery embolization. And they found that here are 131 attempts to conceive. And in this group of patients, 70 patients had the intrauterine pregnancy. And here are 475 patients without fertility requirement, but 8 has the undesired intrauterine pregnancy. And then they analyzed the fertile group and the infertile group and the pregnancy group. They do the relative analysis, and they found that the risk factors for the infertility is that the age is more than 35 years old, and the beta HCG is no more than 5,000 units, and the amenorrhea time is more than 56 days. And they also has done the relative analysis for the risk factors for recurrent CSP. They found that first is the patient treated by UAE, and the numbers of abortion is more than 4 times, and the patient being asymptomatic. So they conclude that HIFU seems superior to UAE in reducing the risk of recurrent CSP. So this is all my talk, and before my finish, and I will do some summary. So first, the advantages of combined therapy of HIFU and DNC for CSP. First is that the non-invasive characteristics and real-time monitoring of HIFU, and this therapy can reduce the risk of vaginal massive bleeding, and also can minimize the damage to the uterine and keep the integrity of uterus, and also to keep the fertility, because the cesarean scar pregnancy patients usually are very young, and many of them has the desire to keep their fertility. And for the perspective, so we need to know that there are still a lot of part for the development and the research for the HIFU treatment for CSP. First, we need to standardize the protocol of HIFU, including the patient selection, clinical dosimetry, and termination criteria, etc. So for the patient selection, I have mentioned before that we recommend to do the HIFU treatment for the endogenic cesarean scar pregnancy. But I find the publication this year that this group, they did HIFU treatment and DNC, the suction carriage for the exogenic cesarean scar pregnancy. And they also report a high success rate as high as more than 90%. So I think this kind of cesarean scar pregnancy maybe need more researches to do to see whether they are suitable for the HIFU treatment. And the second is that we need to do some prospective researches of the effectiveness and the safety for the HIFU treatment of CSP. And also we need to optimize the post-cesarean scar pregnancy, and to need to do some guidelines for the patient to do the following pregnancy. So this is all my topic. Thanks for your attention. Thank you.
Thank you, Dr. Zhang. 张教授，麻烦你看一下，底下有很多的问题要问你，你看底下一下。
Okay.
好，Thank you, Dr. Zhang. No wonder Dr. Zhang is the HIFU mentor and tutor, and set up a lot of the HIFU center all over the world. I am very amazed. If I am free, I will go to Chongqing, because I love Chongqing city. Maybe be your fellow. Okay, is there any question? Actually, we have a lot of the question show in the table.
Okay.
I think. Okay, maybe Dr. Zhang.
Yes.
Someone asked that if the HIFU work, why do you need to DNC again?
Okay, so I think, in my opinion, I think HIFU is like a pre-treatment for the DNC, because we know that for the CSP, if we do the single DNC, that has the very high risk of the heavy bleeding and the risk of the uterine rupture. But as we said in my lecture, is that when we do the HIFU ablation of the implantation area, we can ablate the nutrition vessel, because we know that in that area, the blood supply is very high. And if we destroy the vessel there, and then after that, we move the gestational sac out by DNC, and in that procedure, so the risk of the heavy bleeding should be decreased, dramatically decreased. Because in my experience, if we do the HIFU treatment before and then we do the DNC, the bleeding is no more than, usually it's 10 to 20 millimeter, no more than 50 millimeters.
Mm-hmm. Is there any chance he can go up, the gestational mass go up itself? Is there any chance?
And if you have already ablated the implantation area and you can do maybe the contrast ultrasound to emphasize or to make sure that this area is already ablated, it's rare, the risk is rare.
Actually, you have mentioned now after HIFU for CSP, the recurrent rate is the 23/131. Actually, it is almost 18%. So the recurrent rate is a little high. Do you any about this data here?
So for this data, I haven't seen before, but I only through my literature review. So yes, so for the patient to have the cesarean scar pregnancy before, no matter what kind of method she have done, if she want to keep her uterus, so she have the chance, no matter what kind of the method have done, she has a chance to have a recurrent cesarean scar pregnancy. But when we compared the HIFU with the uterine artery embolization, the rate is lower than the uterine artery embolization. And also, I think the doctors have mentioned before that if the patient has the desire to have another baby, so the UAE is not recommended for her, but HIFU can be another choice for her.
Thank you. Is there any question?
So, may I have? Yeah. Thank you for your beautiful presentation, and it was really eye-opening. And I have one question and one comment. Question: as for protocol, HIFU treatment may decrease the lesion and maybe itself decrease HCG. And your protocol, 2 days or 3 days after HIFU, you do surgery, D&C. But I wonder, maybe 1 week later, it may be more easier. How do you think of it? Why do you decide 2 days after, 3 days after HIFU?
Okay, thank you, Professor Tsutsumi. So this protocol is all by our team, especially under the leading of Professor Zhang Lian. So because after the HIFU treatment, we know that we have the heat effect of the implantation area, and there has some the edema in that area. So the edema will be disappear within 72 hours. So we recommend that in these 72 hours, we do not do any transvaginal procedures for the patient to wait this edema to be disappeared or to be eased.
Okay. One comment. And if you have HIFU, you don't have to do uterine artery embolism, UAE, and because UAE may damage uterine function and also ovarian function. So HIFU is much, much better than UAE, it's my opinion. Thank you.
Yes, thank you. Thank you, Professor Tsutsumi. Yes, it's also what I'm thinking about is the HIFU, especially for the keep the function of uterine or the ovary function is better than UAE.
Yeah. Thank you, Dr. Tsutsumi, and thank you, Dr. Zhang. Because the time is limited, I know there's a lot of question and the need Dr. Zhang comment. Maybe you can go to Chongqing and visit to the Dr. Zhang and face-to-face to ask this question. The wonderful session, and no wonder Dr. Zhang is the HIFU mentor. So I need to close this session. And